Good morning, everyone. It is Monday, July the 6th, 2020. It is currently 8:42 a.m. Central Time, and this is a special live broadcast of the Theology Central podcast. Obviously, I'm not coming to you from the church. I'm currently here in my study in my house. Now, that means at any time there could be distractions, and I do apologize for that. I have one dog laying here beside me. And in the other part of the house, there's another dog. And if one of them decides to bark, well, then this won't sound so professional. So I'm warning you in advance. But this morning, throughout the night, I kept hearing different reports and seeing different things in regards to COVID-19. And the more I thought about it, I thought, you know what? I'm going to grab the microphone and I'm going to go live because I think we really need to consider 5 very important things moving forward, especially Christians and especially churches. What is the future going to look like? Where are we going? What things do we need to be on the lookout for? I mean, here, my church, located here in West Texas, we're back to live streaming only again, and hopefully only for a couple of weeks. But when you look to the future and where things could be headed, I think churches need to have a long-term plan. I think churches are really going to have to figure out what they're going to do, how they're going to move forward, and we need to look at the worst possible case, the worst possible scenario moving forward. Let's say things continue to get worse, cases continue to spread, governments decide to step in and really go full out with locking everything back down. Let's say your church is locked down from somewhere in July to the end of the year. Do you have a plan moving forward? Are you ready for that? And some people say that's absolutely crazy. That's never going to happen. But I'm not going to predict the future, and I cannot predict the future. But what I can tell you, there are 5 things we need to be looking out for. We need to pay close attention to. And if you keep looking for news stories related to these 5 things, I think you will be in a position to have a pretty good idea of where we're headed. All right. And so I'm going to give you these 5 things. Hopefully this will be beneficial and you can take these 5 things, share it with people in your church, people you know. And look, not only does this relate to the church, it possibly relates to your economic future as well, your job. So these are things to be looking out for, and everyone can do a Google search for these things on a daily basis to kind of get the latest news about what is happening. You're going to have to probably look for news related to these things. Sometimes you will find them, sometimes you will not. All right. But here are the 5 things that that I want you to pay attention to moving forward. Now, because I'm here at home, I'm going to try to go through these rather quickly. If I was at the church, this would probably turn into 2 hours. So I'm going to move through these quickly. You ready? Number 1, first thing you need to be looking out for is mutation. Mutation. We need to be on the lookout for if the COVID-19 virus, if the virus and then ultimately COVID-19, if the virus begins to mutate, that's something to pay close attention to because it could mutate in a way that makes it more deadly. It can mutate to make it easier to spread. Any mutation, any report of a mutation dealing with COVID-19 is something you need to pay close attention to. And here's the ultimate reason why. If it mutates, any virus they're currently working on, based on the current makeup of the virus, if it mutates, those vaccines then would become ineffective and for some, basically you could probably say worthless. If it begins to mutate, that will delay a vaccine. You delay a vaccine, that means the COVID-19 situation is going to continue longer than we expected. And if you do just a very search for COVID-19 mutation, you'll come across this. This was updated at 5:30 a.m. today. All right. Dr. Fauci warns new mutation may allow COVID-19 to more easily replicate. Now, this was updated at 5:30 this morning. So when I tell you to look out for news stories regarding to mutation, there you have it. All right. Dr. Fauci warns new mutation may allow COVID-19 to more easily replicate. Okay. Dr. Anthony Fauci, the government's top infectious disease expert, warned Thursday a new COVID-19 mutation may make the virus replicate more easily. It does look like a particular mutation may make the virus more transmissible, Fauci said. And he said this during a discussion. All right. He goes, there's a little dispute about it, but I think the data is showing that there is a single mutation that actually makes the virus be able to replicate better and may have high viral loads. All right. Now, again, what I'm looking for, mutation, you've got, when you create a vaccine, it's got to be based on the current makeup. If it's mutating, then will that vaccine be effective, or will it be useless and you have to go through the process again? If so, you're delaying a vaccine. Delay a vaccine, then well, things are going to continue as they've been continuing. They're going to go on like they've been going on. All right. So that's something we need to pay close attention to. So there's number one, mutation. All right. Number two, transmission. So mutation, how is the virus mutating? Right? If it's mutating, delays vaccine, and it could make it, mutation can make it deadlier. Viruses mutate. That's what happens. Now, listen, sometimes that's a good thing. Sometimes they can mutate and become less deadly. They can become less easy. The ability to spread is lessened because of mutation. It can mutate in a way that makes it worse. It can mutate in a way that actually makes it easier to manage and easier to prevent the spread of. We have to be on the lookout for how it is mutating. All right. I've got a number of news articles here about mutation and COVID-19. COVID-19 will mutate. What that means for a vaccine. Here's another story. Every virus mutates. It's part of the virus life cycle. Those shifts and changes aren't always a big deal. The new coronavirus is a collection of genetic material packed. Okay, so they go into some makeup of it. As the new coronavirus makes its way around the world, there's been an uptick in predictions that the virus will mutate into something deadlier and become even scarier threat to humanity. Now, that's been some predictions. Mutation, the word naturally conjures fears of unexpected and freakish changes. Researchers wrote a report published in Nature Microbiology that the ill-informed discussions of mutations thrive during virus outbreaks. They continued, which is exactly what we're seeing with this virus. So they said at first, there's a lot of ill-informed discussions going on about it. However, we are seeing that with this virus. Now, mutations aren't always a bad thing. Every virus mutates. It's part of the virus cycle. Those shifts and changes aren't always a big deal. In some cases, those mutations may actually lead to a weaker virus. Usually, though, the changes are so slight that there's no noticeable difference in the disease's transmission and fatality rates. That's good, right? If it's so small, then that doesn't change that. Now, they say the new coronavirus is mutating, but very slowly. All right, now that's something to pay attention to. A new study in Florida suggests the new coronavirus has mutated into a variant that's more infectious. All right, that's what people are saying, and that's what we will have to continue to look at. The good news is that a vaccine will most likely work. Okay, now this is good to know. The good news is that the vaccine will most likely work against variants with this mutation. So that's what they're hoping and that's what they're predicting. But there are times where it can mutate to such a level where, guess what? The vaccine will not work. So that's something, we have to pay close attention to that. We have to be aware of that. So pay attention to any news about the mutation related to COVID-19. Now, number two. Transmission. The next thing we have to pay close attention to is, how is COVID-19 being transmitted? How is it being spread? Because this is very important in trying to know how to protect yourself, how to protect others. And this would have a great impact in obviously churches, businesses, sporting events. When can you reopen? Well, how it's transmitted, unless we have a good understanding of how it's transmitted, then unless we have that understanding, we can't have a good understanding on how to prevent the spread of it, what precautions to take, what things are working, what things are not working. How is it being transmitted? Well, late last night, there was new news in regards to COVID-19 and how it's being transmitted. I heard what I'm about to play for you. I heard at 1 a.m. At 1 a.m., there was a news story about the transmission of COVID-19. Maybe you've heard it, maybe you haven't, but you need to know it. Here we go.
Hello and welcome to NewsHour from the BBC World Service, coming to you live from London. I'm James Kamarasamy. The list of countries with the highest number of coronavirus infections changed today, with India leapfrogging Russia to record the third highest number of cases overall in the world after the United States and Brazil. But we're going to begin the programme not by considering where the disease is being transmitted, but by considering how, because more than 200 scientists from 32 countries are urging the World Health Organization to revise its advice on how to stop infections. They argue in a letter that the WHO is underplaying the airborne transmission of the virus, that is, the transmission through smaller droplets which linger in the air as opposed to the bigger ones expelled by coughs and sneezes. As we're about to hear, that could have implications for the use of face masks, social distancing and much more. Professor Mario Molina is a Nobel Prize-winning Mexican chemist who supports the scientist's letter. He published a paper last month entitled Identifying Airborne Transmission as the Dominant Route for the Spread of COVID-19. And he told me his understanding of how the virus is transmitted.
It is transmitted to a significant extent by these very small particles that we call aerosols. These are the particles that float, in contrast to the larger drops that you emit when you cough or you sneeze. The small particles, the aerosols, are emitted when you talk, and they can be infected. And we're looking at the data reported of cases and so on. It's very clear that when governments implement the measure of using a face mask, that we see a very clear change downwards in the number of people that get infected.
So just to be clear, the face masks, they protect you against these aerosols, these particles that are lingering in the air, do you? Because generally it has been said that the importance of the face masks is to protect other people, that it's you who are expelling the droplets which might be infectious.
Yeah, we disagree with that. What we think is that it's even much more important for the face mask is to prevent you from breathing these small particles, whereas the WHO and so on, the original idea was that you use face masks only so that you don't emit large droplets. And there are several other indications people getting infected when they are in a closed room, such as when they are singing or they are doing gymnastics or whatever. It's clear that infections propagate that way, and that cannot happen with the large droplets. That's happening with the aerosols.
Why do you think the WHO has been so reluctant to recognise that airborne transmission could be the main pathway?
We are not sure. We're part of the community that deals with aerosols. We thought we should communicate. It should be two scientific groups that can certainly work with each other. What appears to be the case, according to some thoughts, is that the coronavirus is handled by certain epidemiologists that deal with virus. The epidemiologists were very close-minded. They didn't want to pay much attention to scientific findings or articles that did not have one of them as a co-author. That's what appears to be the case.
So you're saying that social distance in itself is not enough, that staying 2 meters more even apart would in itself not be sufficient to really get a grip on the pandemic?
That's correct. And the one way to explain it is these particles behave a little bit like smoke from cigarettes. And that can, if you are in a closed room and there's not very good ventilation, the smoke can reach from one corner to another, and it can stay there for many tens of minutes, if not hours.
So the implication is not just that we should wear masks, but that businesses, restaurants need to really perhaps rethink their ventilation, rethink how the air circulates through the building.
That's right.
Which has implications for costs, etc., doesn't it?
That's right. But this is also an old story, because air pollution also causes harm, because these small particles, when you breathe, they get directly into your lungs, okay? So there are a number of studies before the COVID-19 that suggest that what you need to have good ventilation, particularly if you live in a polluted city. So you need some ventilation, and it doesn't have to be very expensive.
Nobel laureate Mario Molina from the University of California, San Diego will be.
Well, there you have it. Transmission. Is it airborne? If it is airborne, well, a couple of things that we learned in that report. If this is true, if this turns out to be accurate, true, verified, peer-reviewed, proven, if it's airborne, well, there's a couple of things. One, it makes the mask even more important. Now, I know there's still Christians running around. There's people still running around all over the internet. Don't wear a mask, don't wear a mask. There are even groups forming on Facebook of anti-mask people saying they're not going to wear a mask. They're not going to follow the rules. But if this report is true, the mask is even more important. Not only are you wearing a mask to stop you spreading droplets, when you speak, or you sneeze, keeping you from spreading anything, it also is going to protect you from breathing in this if it is airborne. And if it is airborne, please note one of the things he said, being in a closed room and singing sounds like church. Now, California passed a rule about this, and people are losing it, saying that this is an attack upon religion, and this is the end. That will have an impact on sporting events, concerts. It will have an impact on everything, not just churches. And as a church, you have to think about this. If it's airborne and you're in a closed-in building, do we open? Do you not open? So the transmission of this, we need to keep looking out for any reports about being airborne. Is it going to be disproven or is it going to be proven? Will the World Health Organization look at this and then acknowledge it and then make recommendations in light of the information? Look, whenever you have a pandemic like this, whenever you have a virus that is spreading, you have to keep up with the information because it's constantly changing. And what scientists think they know today may be different 2 days from now, a week from now. And whenever that happens, then people lose it and go, well, see, they don't even know what they're talking about. Look, they're trying to figure this out. Now, your job is to try to get the most up-to-date information, and that means you need to be vigilant, and that means you need to be doing research, and you need to be paying attention. And stay away from the conspiracy theories, because when you're dealing with a pandemic, conspiracy theories that give you false information basically equals possibly killing people, and we don't want to do that. So what do we look out for? Number one, mutation, mutation, mutation. How is the virus changing? Becoming more deadly, becoming more infectious. How is it changing? We need to be on the lookout for that. And how will that impact the making of a vaccine? Number two, transmission. How is the virus being transmitted from person to person? How is it spreading? Is it now airborne? If it is, can it linger in the air, not just for minutes? Could it linger in the air for hours? All right. Well, what does that mean for any closed-in building? It doesn't matter where you are. Supermarket, doesn't matter where you are. If it's lingering in the air, I mean, what does it mean about reopening? What does that mean for churches? What does it mean for schools? Right? I mean, there's all the talk about schools reopening here in August. Well, if it's airborne, it can remain in the air for possibly hours. I mean, we need to figure out exactly how long it could. I mean, what do you do for schools? Like these are things we need to look out for. So number one, mutation. Number two, transmission. Number three, death rate. Death rate. Now, this is very important because there's all kinds of discussion about this. Well, it's not really that deadly. The death rate's going down. Don't really worry about it. Okay, here's what we can be absolutely positive about. Please understand this. When the number of cases begin to rise, the death rate will be lingering behind the number of cases. So in other words, the cases go up, death rate will not immediately go up. It lingers behind because here's what happens. First, someone gets tested that they have it, right? So they have it. Then the virus begins to run its course. Is it going to be really deadly in that particular individual? Is it not going to be deadly? How long do they struggle with the virus? They could struggle with it for a week, maybe 2 weeks. They have all these problems. Maybe then they end up on a ventilator, then they die. So cases go up. That's the initial reporting of the cases. The death rate is going to linger behind probably by 2 weeks. So when you see an explosion of cases and the death number is not rising, don't go, oh, see, that's not deadly. Wait 2 weeks and see if the death rate begins to increase. If it does, by how much? The deadlier the virus is, okay, the more, if the death rate begins to explode upward, right? If there's a major spike in the death rate, then you will have mayors and governors and elected officials that will start shutting everything down. If you're paying close attention to the death rate, you will have a very good idea of what's about to happen, right? But just know the death rate lingers behind it. You get the initial reports of the cases. We had 300 cases of COVID-19 yesterday. Let's just say that's the number wherever you live. In some places, thousands, Florida, Texas, like if you look at the state numbers, okay, let's say you have 10,000 cases yesterday. Well, the death rate's not going to immediately jump up. You're going to have to wait 2 weeks, 3 weeks, and then see what the death rate is doing. So pay attention to the death rate. Now, just so that you know, there is a lot of discussion. Here's a report. The pandemic's big mystery. What is the big mystery to COVID-19 pandemic? What is the big mystery? The big mystery is, how deadly is the coronavirus? Scientists still don't really know. Even with more than 500,000 people dead worldwide. Now, please note, 500,000 people have died. Scientists are struggling to learn how often the virus kills. So they're still trying to figure out exactly how deadly it is. So there's a lot of speculation. All you can do is try to look for the death rates in the area you live. Look at if the cases are going upward, then look at the death rate over a 2-week period. And if it starts going upward, right, then that gives you some idea. Man, the more cases, more people die, death rates increasing. Now, you look at whatever the death rate is, whatever the percentage is of how many people are dying versus how many people get it. If that percentage continues to increase, that's when people all of a sudden get worried. Like if people are just getting sick, a lot of people will just dismiss that. People start dying in large numbers, everything's going to get shut down. So be looking out for the death rate, all right? And this is very important, all right? And so I could read everything about the death rate, but you get the idea. So 3 things we're looking out for. Number 1, mutation. How is it mutating? Number 2, transmission. How is it being transmitted? And now we have reports of it possibly mutating. We have reports that it's now moved to an airborne kind of situation. That's something we need to be on the lookout for. 3, death rate still remains a mystery, but we need to be looking out for it. And then number 4, this is another big thing that will bring lockdowns quickly. Hospitalizations. Find out in your area how many people are being put in the hospital, being admitted to the hospital, how many hospitalizations there are in your area. If the hospitals start filling up and where they have no more room, you are going to find yourself with restrictions being implemented in the area in which you live. The hospitalization rate is the easiest way to predict what's going to happen. It is very easy. That's the one number that nobody can really debate. Hey, here's how many admissions were in the hospital for COVID-19. We ran out of room. You can't debate those numbers. That's the number to pay attention to. Now, let me give you an example of how this works. All right, 4 Tampa area hospitals at maximum ICU capacity. 4 hospitals in Tampa were at maximum intensive care unit capacity over the weekend as the number of coronavirus cases in Florida continued to spike. So they've got hospitals that their ICU is filled. Well, once you start hearing reports of the hospitals being overwhelmed, the medical systems being overrun because of COVID-19, they're going to lock everything down because that was the main concern, was hospitalizations and overwhelming the healthcare system. Pay close attention to that. That's a number. I like that number because you can't debate it. Here's how many hospitalizations. End of story. Now, if the hospital's empty, Well, then good. That means the healthcare system is not being overwhelmed. Doesn't matter if the number of cases are going up. The medical system is there, still able to handle everything. It's not being overwhelmed. That's the numbers to look out for, all right? So hospitalizations, are they going up? If the hospitalizations are increasing, then you know what's coming. You're going to get restrictions in your area. So mutation. How is the virus mutating? It is mutating. And we don't know what that's ultimately going to lead to. They think it's mutating and it's going to make it easier to spread. And it's going to be easier for people to get infected. That's the thought. Number 2, transmission. They're worried that it's now possibly airborne and it's going to be transmitted that way. And this is going to make wearing masks even more important. And it means that it's going to possibly have a profound impact on, churches, schools, anywhere, okay, because it could just remain in the air. We need to know for how long it can remain in the air. Number 3, death rate. If the death rate is the death rate does not immediately go up because cases go up. You have to look out. Usually it's about a 2 to 3 week delay before that death rate moves. Pay attention to the death rate. So, for example, you live in Ohio, you live in Tennessee, wherever you live, look at what the death rate was 2 weeks ago, right? 3 weeks ago, and then look where the death rate is currently. That will tell you if it's going up or going down. If it's remained the same, look at how the number of cases have increased or decreased during that 3 week period. Then you can say, well, the number of cases have exploded in 3 weeks. Okay, then don't look at what the death rate was 3 weeks ago. Don't look at what the death rate is today. You're going to be wanting to know where the death rate is 3 weeks from now, because then you're going to see how much it's going up in relation to the number of cases. Hospitalizations is so important because that indicates if the medical system is becoming overwhelmed. And if that's happening, you're going to get lockdowns. Doesn't matter what you think. And then number 5, another thing to watch, which everyone hears this every day, the number of cases. The number of cases is the one number that you hear constantly, all right? For example, I'll just go to the first report I see. Rising coronavirus cases in 39 U.S. states cast a shadow over the nation's 4th of July celebrations. In the first 4 days of July alone, 15 states have reported record increases in new cases of COVID-19, which has infected nearly 3 million Americans. Florida's cases have risen by over 10,000 for 3 of the last 4 days, including climbing by 10,059 on Sunday alone. You got all of these states where numbers are just going up, they're going up. That number you're going to get. All right, now, but just remember, the number of cases, death rates is going to be behind that. It's going to linger. So don't get all confused. So here are the 5 things you need to be looking out for. Number 1, mutation. How is it changing? How is it mutating? If it's changing and if it's mutating, how is that going to impact the formation of the getting ready of a vaccine? And is it going to become more deadly, easier to spread, or is it going to mutate in a way that makes, possibly begins to eliminate the threat of being serious? That's something we want to pay attention to. Transmission. How is it being transmitted? How is it being spread? Is it now airborne? What does that mean? All right. It will mean the mask is going to become, I think you're going to see more and more push for the mask becoming mandatory, which is only going to create more of a division among people. Listen, don't get caught up in trying to prove a point. You're not trying to prove a point here. The only thing you want to do is protect other people's lives, protect yourself, and do everything we can so that we can get past this so things can reopen. If thousands of people are running out there to make a point, the only point they're going to make is they're going to become responsible for spreading it. They're going to be responsible for things not being able to reopen. And that's not what you want to do. You're not there to make a point. Mutation, transmission. Number 3, death rate. Look at the death rate. Remember, I'm going to keep stressing this. The death rate will linger behind the number of cases. It's not, you don't get, hey, today we had 10,000 new cases and we had this many deaths. Those deaths are not related to that day's new cases. It's related to the cases, the number of cases probably 2 weeks ago or 3 weeks ago. Hospitalizations, that's the one number that you can get away from all the debates. How many people are being admitted to the hospitals in your local area? Are the hospitals being overwhelmed? If the hospitals are reporting they're overwhelmed, that's a red alert that, your local area is going to have to take some serious steps to try to stop it. Number 5, number of cases. That's the one number you're always going to get, and that's the number you need to look out for. Now, please note, in all of that, you're always going to have your conspiracy people believing that no number is real, no report is real. The only report and the only numbers that are real are from the conspiracy websites that they found from some YouTube video that someone made, and they're going to deny all official reports as being a part of the conspiracy. Once people fall down the rabbit hole of conspiracy thinking, it's impossible to get them out. Here's the reason why. They have the conspiracy. They find some information from some questionable source that seems to support their conspiracy. You come along to provide counter information that contradicts the conspiracy, and they'll tell you that information is part of the conspiracy. Therefore, they can never be proven wrong. Therefore, they find themselves in the conspiracy wheel. Like you're like a little mouse running on a wheel, and you can't get off, and you're not going anywhere. And at that point, there's no point in even engaging in meaningful conversation. It's sad when people fall into that, because they can get themselves manipulated and put themselves in danger. And sadly, they can put other people at risk. All right. Those are the 5 things I want you to look out for today. Let me read them to you one more time so that you have them memorized. Mutation. Transmission. I know you're probably getting irritated that I repeat them more than once, but mutation, transmission, death rate, hospitalizations, number of cases. Now, I don't know where we're headed. I truly don't. I truly don't know where we're going. I just know that the cases continue to rise, and this is going to become a major issue for the economy, a major issue for churches moving forward. And I know right now we're in July. Before you know it, we're going to have COVID-19. We're going to have the flu season beginning to start. I don't know how deadly the flu will be this year. We're going to have flu. We're in COVID-19. And there were initial reports at one point of a possible flu-like virus in China that could become a pandemic. Now, I don't know if there's any truth to that. I haven't heard any more about that. But if all 3 of those things were to come at the same time, the future is going to look like a complete lockdown. And your church, my church, needs to be prepared for the worst case scenario, hope for the best. And this is the one thing we can do as Christians. We can focus on our spiritual condition, focus on trying to present the gospel, trying to disciple people, because, we've got to get our focus on the right thing, and our churches need a good plan. And look, no matter what is happening, pastors can do what I'm doing. They can turn on a microphone. We can preach. We can disciple. We can pray. We can help people. If they just started reading the Bible, we can do outreach. Just use the technology. That's the one thing. No matter what happens, we have the technology. Here I am sitting in my house. I'm live on the air. Doesn't matter what's going on outside around me. Doesn't matter if the whole city is locked down. Nothing is stopping me from turning on this microphone going, hey, let's look at this passage of scripture today. Hey, let's do a devotional study today. Hey, let's do this. There's nothing stopping that. All right. There's nothing stopping saying, hey, send me your prayer request if you have a prayer request. There's nothing getting a prayer chain going on in your church. And then as people send in prayer requests, send it to all those people. If they're truly committed to pray. They've got to really be committed to pray. You don't want people saying, yeah, I'll pray for you and then never do so. But there's lots of things you can do. And then we can just look around for people in need and see if there's anything we can do to help. We can still be the church. Just may look a little differently for the next 6 months. All right, I wanted to bring all that information to you. I wish I could have gone into a little bit more detail there, a little bit more. But if you have any questions, if you're confused, send me an email at newsif@yahoo.com, newsif@yahoo.com, newsif@yahoo.com. Please help people think about this situation logically, rationally, based on actual facts. Please try to protect people from ending up down the conspiracy rabbit hole where there's no hope of them ever coming back out. Please try to protect people from that. lovingly try to correct misinformation and false information. You don't want to put someone on full-blown blast in front of everyone, but you may want to try to pull them aside in private and say, hey, come on now. Don't do that. And if you see people out there just trying to make some crazy point about a mask, like, if to wear a mask means the end of their civil liberties and the Constitution is on fire and the White House has been destroyed and it's the end of America, let them know that, mask requirements were true in 1918. Mask requirements in the medical world is common. I've stated it before during flu season. I would put masks on people everywhere I could find them because I was at work. I didn't want that garbage being spread anywhere. I wanted to protect myself and I wanted them to protect others. And we wanted to keep the flu from spreading more and more and more. We wore masks in all kinds of different situations. If people were coughing or sneezing, we would put a mask on. We had separate waiting areas for people who were showing symptoms and people who were there for other things, trying to stop the spread of certain sicknesses and certain things. So it's not this like the end of the world and they're going to come and take your Bible and your gun and your Fox News. It's not like they're coming to take you away and you're going to, some kind of horrible, re-education camp. Just, man, if you're asked to wear a mask, just put on a mask. Now, as those restrictions, if more restrictions are coming, how church is going to respond? We're going to have to be wise. We need to be as wise as a serpent, harmless as a dove. We need to be careful. We need to be thoughtful. And I understand, if they pass a rule that you can't sing in church, what do you do? Some say singing is commanded in Scripture, so we have to do so. But you could also argue meeting is commanded. So should you meet? How do you work that? There's going to be lots of debates there, but the debates need to be rational, thoughtful, biblical, and we need to make sure that one of the major things that drive us is love for other people. All right. So something clearly to think about. All right. I'll stop right there. So much more I want to say, but I wanted to bring that to you. Let me know if this is helpful. Let me know if this is beneficial in any way, and just look out for one another. Be careful, be safe, and let's pray that God would have mercy and bring this horrible situation to an end as soon as possible. Pray for those who are sick. Instead of arguing about it, let's pray for those who are sick. Pray for those who are infected. Pray for people around the world that they will not become infected. Pray. Maybe it's time to pray and fast. Maybe churches, instead of arguing, we need to be praying and fasting, right? Instead of trying to go out and make a point by running into a grocery store without a mask so that you prove that you're, powerful and bold and you're the big man and you're not going to bow to liberals. How about just showing love and respect and let's try to help one another through this, and let's show compassion, and let's be helpful, and let's be salt, and let's be light, and let's try to handle this in a godly way. All right, I'll stop right there. Email me newsif@yahoo.com, newsif@yahoo.com. Thank you for tuning into this special live broadcast of the Theology Central podcast. You can thank my dog Connor. He's right here. He at one point when I was playing that audio, he did start barking and going crazy, but I called him back in here and he laid down while I was talking. So we can all thank my dog. All right, there we go. My dog did well. All right, there we go. I don't know if I'll be back on the air live today. If there's something you want me to cover, if there's any issue, any Bible questions, theology questions, anything you want me to talk about, there's a news article, just email it to me and we'll see. I may be on the air live late tonight. I may go live tonight around 10 p.m. and maybe go from 10 p.m. to around 1 a.m. is what I'm possibly thinking, but we will see. All right, everyone have a great day. God bless.